Hello everyone and welcome. I'm Ayşe Seval Palteki and I work as an assistant professor in the Department of Public Health at Istanbul Medipol University and as a postdoctoral researcher in Southern University of Science and Technology in China. I'll be moderating today's session. This webinar is one of the several events organized by the Society for Public Health Thinking and Innovation, which is also called as HADI, as part of the European Public Health Week 2025. And to briefly introduce HADI, it's an independent professional association made up of public health researchers and professionals based in Turkey. Today's daily theme is global health, food systems, health security, climate, and sustainability. The title of the session is Assessing How Healthy and Sustainable Cities Are. Our speaker is Dr. Hüseyin Küçükali, and I'd like to briefly share his biography. Dr. Hüseyin Küçükali is a public health researcher at Utrecht University. His research focuses on the prevention of non-communicable diseases in urban environments. Dr. Küçükali has a background in medicine and PhD in public health. He is experienced in data science and health behaviors. This session is scheduled for 1 hour. I'd like to remind you that the session is being recorded. We will answer questions at the end of the presentation. Please feel free yourself to write your questions and comments during the presentation in the chat or QA section. If you are ready, dear Dr. Hüseyin Küçükali, the floor is yours.
Hello, everyone. First of all, thank you for having me today. It's an honor for me to be able to share some recent work of mine and also some recent developments in the field of public and planetary health in the context of urban environment. So let me share my screen. Yeah, today we are going to talk about assessing how healthy and sustainable cities are. So first, I would like to start with talking a bit about what makes cities special and important in terms of health and sustainability. It is now we know that at the moment almost half of the world's population live in cities, and by 2050 it is expected to be almost 7 out of 10 people will be living in cities. So cities are important due to accumulation of resources and information, but particularly for health and sustainability, because not only because most of the people live here, but also the urban policies and city planning actively shapes how people live and move around, determining the neighborhood form that we are living in, the function, and because of that, the exposures environmental exposures that we are exposed to, and lifestyles of urban residents. So now city planning is more and more recognized as a part of comprehensive solution to tackling health outcomes and adverse health outcomes, and also many United Nations Sustainable Development Goals. So well-planned cities have the potential to reduce non-communicable diseases, but also injuries due to motorized vehicle use, and promote health and well-being more broadly, providing services and infrastructure. So this can be achieved by reducing automobile dependency, traffic exposure, and air pollution due to those, and also noise and urban heat island effects, while also on the other side, it can also enhance mental health and contribute to climate change mitigation activities. So it is now be very essential I mean, in summary, cities are critical focal points because of the concentration of population and activity of residents. They offer many opportunities for innovation and well-being, but also it means also the concentration of environmental exposures and health risks. So it means that how cities are planned, designed, and managed directly determines whether they become drivers of better health or an equity, or exacerbating the existing health problems, public health problems, environmental problems, and inequities. So the need to transform city planning is urgent for future of both public and planetary health. So we are talking about healthy city. Here is a definition by WHO European Healthy Cities Network. A healthy city is one that continually creates and improves its physical and social environments, and expands the community resources that enable people to mutually support each other in performing all functions of life and developing their maximum potential. So it is a mouthful, but basically it acknowledges the biosocial definition of the health by the WHO, and also it emphasizes the importance of the infrastructure, environments, and supporting health promotion, or in other terms, salutogenesis, generation of health. So yeah, for those who are not coming from public health background, I thought maybe it is also helpful to mention this very well known determinants of health model. So in the center you see people, and they have some characteristics, and their health behaviors are influencing their health outcomes, but also the community that they are living in, the social networks, social relationships, influencing both the lifestyle and the health outcomes. It happens within the local economy, their employment, income, and the work settings. So it links to the more higher level influences on health based on built environment, including streets and roads, but also the buildings that we are living and working in, and also the natural environment around us, green spaces, blue spaces, and at the end, it is the global ecosystem with climate and biodiversity links to all of those other mentioned factors. So more specifically, in the urban health context, there is a good framework by Lancet Commission in 2016, and this is a summary of that framework. If we look from right to left, we can see that health and sustainability outcomes are the most relevant health and sustainable outcomes are here. As you can see, road trauma and many non-communicable diseases, including respiratory diseases, cardiovascular disease, diabetes, cancer, and also maybe it is after going through COVID-19 pandemic, it became even more visible that for infectious disease dynamics and heat stress, all those health outcomes determined by the urban systems. So maybe it is worth focusing a bit on the transportation related exposures. Here there is a traffic and it creates to some degree air pollution, especially within cities. Almost, I guess, 1/3 of the air pollution comes from the automobile and the energy usage by cars. So and also it is also linked with noise, but also physical inactivity. So your transportation mode, whether you are passive, you are using passive transportation modes or active transportation modes, it has an impact on the many non-communicable diseases, as you can see here. So linking to prolonged sitting, etc. But also worth to mention also the availability of the food, the healthy food options in the environment, influencing unhealthy diet, and also goes downstream to creating metabolic diseases. So the focus will be here in the urban transport planning and design interventions. The Lancet Commission focused on this 8 Ds here. You can see 8 Ds. First, starting with destination accessibility. It is about ensuring people can easily reach the important destinations like jobs, shops, or services, etc. So the distribution of the employment, promoting a balanced distribution of jobs across city, rather than concentrating them in only one area. So just give me a second, please. Sorry, just a second. Okay. So again, the demand management, the policies aimed at reducing the demand for private car use, often by making driving less convenient or more costly, or reducing the parking areas, or also the promoting the more active transportation modes. So design, those were the regional planning related interventions, and we also have design related, local design, urban design related interventions. It includes focusing on creating pedestrian-friendly, cycling-friendly networks, road networks, also street connectivity and safety. It links to the density because there is a optimal level of population density in residential area. If it is below the optimal area, so it means that the necessary services may not be available. But if it is overcrowded, then other problems arise. So there is a sweet spot between those two ends. So distance to public transportation, to reduce average distance people need to travel, but also the accessing to public transport, frequent and affordable public transport. So we missed diversity. It is about the diversity of land use, mixed land use within neighborhoods, encourage. I mean, think about average American city that you necessarily need to use car, but if you can think cities like, say, Barcelona or some other cities that have policies for mixed use, then you can live your life with most of your required services available within a certain area from your residence. Then you will be more likely to be active, choosing active modes of transportation instead of car dependency. So and also we have desirability. Those until now, those are very maybe mechanic elements, but desirability is about the attractiveness of places that we live. The infrastructure, walking and cycling infrastructure, where they are built, and creating safe and appealing neighborhoods, green spaces, and transit networks. So those are 8 Ds of urban interventions that enables healthy and sustainable cities. So before going into the specific indicators, I would like to also mention co-benefit between health and sustainability outcomes, because here you can see, just as an example, from a very recent paper, they focused on urban green infrastructure and its link with sustainable development goals. You can see it, if not all, but most of the sustainable development goals has some sort of relationship between the urban green infrastructures. I mean, needless to say, the climate action, for example, the green spaces create microclimates, improves air quality and disaster risk reduction. But also we can mention that they enhance biodiversity, and it regulates air and temperature. So all those synergies between sustainability and health is possible. Here we have another. I have another example. It is focusing more on the physical activity. So here you can see that based on 3 different sources, the researchers were able to map almost all of the sustainable development goals into linked with the physical activity. So they used WHO's physical activity guidelines. They used peer-reviewed scientific literature, and also expert opinions. So at the very center, obviously, there is the good health and well-being and sustainable cities and communities, but you can see that how also it is linked with many different sustainable development goals. So let's go through the specific indicators of a healthy city. So, but before that, why using indicators? Why we need that? Why we need to measure health and sustainability of a city? So there could be many reasons for that, but those are main categories that I identified. For comparison reasons, I mean, it is essential to monitor, especially the progress over time towards those health and sustainability goals. Are we in the right way? Are we getting any better or worse? And also comparing between cities that to learn from each other. But also evidence-informed policymaking. Indicators provide data to inform urban planning policies, transportation policies, design decisions, making them more evidence-based decisions. It enables identification of inequities, existing inequities, so we can make a neighborhood level analysis that will enable us to reveal disparities between the neighborhoods, whether health promoting resources are equitably distributed across city. We also need indicators for accountability to health policymakers and city governments accountable for their activities to drive action. So environmental and public health action. It is very useful that when, I mean, it is a famous saying that if you don't measure, you cannot manage, or the other way around. If you measure, it's done. So, but also engaging other stakeholders, developing common understanding between stakeholders in urban policy making and decision making. So let's start with transportation related indicators. Those are from literature review. They went through almost 20 different reports and guidelines of healthy and sustainable cities, and they collected all different, many different indicators used in the literature and by those guidelines. So we can start with transportation because it is, as you see in the conceptual framework I have shared earlier. Transportation plays a very central role in the link between urban policies and planning with health and sustainability outcomes. So for walkability, the street, the indicators may include safe street infrastructures, lighting, and the pedestrianized streets, improved signages, street connectivity may be one of the essential indicators. Also the trees, shades in streets, the traffic management, speed bumps, pedestrian crossings, places to stop and rest like benches, etc. for especially age-friendly environments. So again, as I said, the very central is that the street connectivity, because to be able to use active modes of transportation, you need that streets are connected and needs to be connected enough and needs to be in human scale and not car scale. So the blocks within neighborhoods should be in walkable distances to wayfinding. Yeah, so those kinds of things can be an indicator of a walkability. Also, similar to that, bikeability, like bikeways, bike lanes, a network of not only streets but also the bike networks, because if you are going to use bikes to go to the destinations of interest, like shops, you need to be from your residence to that destination needs to be connected. Otherwise, it is not feasible for people to use it. So it can include bike parking, bike sharing services. But in general, also, other than this pedestrian and cycling, like the active modes of transportation, also to what extent a city encourages public transportation is also matters. So it's the indicators related to public transport access includes the distance to stops of public transports, different transportation options, so access to quality, high quality transportation services, and which energy source those public transport use, like whether it is electric buses or just oil-based buses. It can also be an indicator of public transport. Yeah, let's go to other category, physical chemical environment. It of course starts with air quality. What is the for main air quality markers like PM 2.5, NO2, and black carbon, etc. There might be indicators for air quality, but also there can be indicators to policy, whether there is a policies. There are policies for reducing air pollution, transport-related carbon emissions, or policies for alternative energy sources. It can also include low emission zones, etc. So the other one is thermal comfort. Whether there is a policy to facilitate proper ventilation and airflow in streets, and to mitigate heat island effect, providing shared and shelter, especially for vulnerable sections of the population. The noise management, ambient light, including night light at night. So yeah, lastly, natural resources like the mitigation for the flood risks, storm water management, those kinds of indicators also could be measured, also including the biodiversity and the species within city. Next is more about the access to various infrastructures or services, amenities, let's say, starting with urban green and blue spaces, natural spaces, trees, forests, urban forests, gardens, etc. So there is a increasing trend in nature-based solutions, also in urban health domain. Access to healthy food, so fresh food, the access to grocery stores that are providing fresh food, fruits and vegetables. Yeah, promote whether there's policies promoting the healthy food environments or the any barriers for junk food. The restaurant chains that are that are producing unhealthy food. So also the access to drinking water, whether it's a general water system, but also having water fountains, dispensers, and the prevention of drinking water. I guess last category is infrastructure and services. It can be ranging from public open spaces like playgrounds, again parks, but also the community centers, those kind of spaces. Improving public participation, community-driven policy-making approaches, providing or fostering social civic engagement, etc. Maybe community, the neighborhood communities, and those kind of stuff. So there could be metrics or indicators for each of them. Health services and safety, maybe it is a bit the first thing that comes into my mind in thinking about a healthy city, but as you can see that it is only one of the thing is among many others for the being a healthy city. So there was an emphasis of becoming a healthy city in the government, but I noticed that sometimes this kind of discussions evolve into focusing on the providing health services, healthcare, instead of really providing health. So yeah, it's another topic and to be discussed in another session. Yes, including affordable services, health services, but also we have housing, again, affordable housing, and using the housing that use sustainable materials, and also high indoor air quality. So maintenance is about the maintenance of the city, like the waste management, the pest management kind of stuff. Arts and culture, relevant indicators are also mentioned in the literature, whether there's a social and cultural diversity, repurposing of historical assets and making them being in use, showcasing local food, local products, and street events, and preservation of the historical sites also can be an indicator of a healthy city. Parking and smoking-free environments also taught as a indicator for healthy cities, whether to extent of the smoke-free areas, if there are enough signages or bans on tobacco advertisement in public spaces. Last but not least, mixed land use is, as mentioned in the conceptual framework, links to many other things we have talked about that enables the rest of the many indicators. So how we are going to measure those indicators? So there are many approaches, but we can focus on two methods here, measurement methods. One based on policy documents and the other one based on geospatial data in general. So for using policy indicators, we can assess the presence and quality of policies relevant to aforementioned indicators, whether there's a policy or not, but also the quality of the policy, if it aligns with health goals and sustainability goals. So those policies look at the determinants of the health, upstream determinants of health, so leading to health and sustainability outcomes. So, I mean, it could be just, as I said, present, whether there is a policy or not, but also if there is a measurable target within policy, and if the policy is aligning with the health and sustainability goals. So the other one is using spatial data to analyze those indicators. It provides the current state of the indicator. So maybe policies can be more about the future, the direction, but geospatial data can provide the current state in a given indicator. Also, it can be very fine level, in very granular level, from street level, neighborhood level analysis, providing cross section of or just a snapshot of the built environment features that support healthy and sustainable lifestyles. As mentioned, it can include population density, intersection density, like the street connectivity or another way. But also it can be calculated by using geographical spaces, geographical information systems and satellite imagery directly, but also the composite indicators like walkability, bikeability, as we discussed earlier, can be calculated. I want to highlight the importance of using open data and open source tools, because it will enable that those indicators are measured for not only specific high resource setting, but also all around the world, providing evidence-based policy making, planning, and design for low resource setting as well. So really valuable to use, but also the availability of the data, the granularity of the data change between different contexts. So maybe it's the quality or the depth of the open data may not be good enough for every city. But we can find some basic, and studies show that there could be basic set of indicators to be measured for cities around the world using open data geographical information systems, and then it will allow to comparison between cities and within time to, as I said, to help the policy makers and decision makers accountable and see the progress, monitor the progress towards health and sustainability goals. If I have some time, I would like to share a brief example from Belfast City in Northern Ireland. This is my previous research group that conducted this analysis for Belfast City. So here you can see a cover of the report by Global Healthy and Sustainable Cities collaboration for Belfast City. And here with this example, I just wanted to show how it looks like, those kind of analysis looks like in general. So there are many identified policy indicators, as you can see here, whether there's a specific health focused action in metropolitan policy, specific health focused action in transport policy, air pollution policies, etc. So for Belfast, for example, all of those policies were available, but you can also compare with other countries. Here you can see image of percentage of population with access to specific amenities, as we discussed, to public transportation, public open spaces, and grocery stores, specifically food markets. So here you can see as how city is performing, or the current state of city in each of these dimensions. Again, for walkability, you can see the map of the city of Belfast and which areas are more walkable, which areas are not. And just on the right side, you can see the walkability related policies, whether there is a policy and with a specific aim or standard, and whether there's a measurable target. So here you can see that for Belfast, there are policies, but none of them were measurable. And also whether it is aligning with health evidence, existing body of health evidence. So population density are another indicator, and street connectivity another one. So you can see not only overall score for a city, but also you can see the disparities within city, which areas has the minimum meeting the minimum threshold for urban population density, which areas don't. So for areas don't meet population density, for example, they can be more car dependent instead of being able to choose active transport modes. So again, street connectivity shows this similar opportunity. So availability of public transport access, for example, in this left side, you can see population within 500 meters of public transport with 20 minutes or better average frequency. So it needs to be close, it needs to be frequent to be a good choice for people. So on the right side, you can see the relevant policies. Access to public open spaces. Similarly, there is a defined threshold for here for 500 meters to public open space of area of 1.5 hectares or larger. So both the distance to open space and also the size of the space matters. So here I would like to also highlight that the focus should be on the upstream determinants of the health behaviors, not only the behavior itself. So the decision of using or the choice of using the active mode of transportation depends on the opportunity of the people have. So it is not those behavior transportation related behaviors do not occur in vacuum, instead determined by upstream factors. So those are the key actors within cities, starting with citizens. So I wanted to end up with highlighting the actors. So those kind of analysis, those kind of indicators should be evaluated involving all those stakeholders. So local populations can be involved as directly using participatory methods, but also like citizen science methods, etc. But it is very important to prioritizing policies favoring most socioeconomically disadvantaged subgroups. Also, professionals like urban designers, planners needs to be involved, obviously. There are different levels of government, local government, and the national or regional government has different responsibilities in different countries. So all of those needed to be involved in the measurement and the monitoring of the indicators, healthy and sustainability indicators. International organizations like UN Habitat or WHO are providing many guidelines and also play a key role in promoting those healthy city targets. As mentioned earlier, WHO has a healthy cities network and many other resources. Knowledge institutes, including universities and the companies, the research companies, can be research and development companies can be also involved in definitely in this analysis for measurement of this indicators, but also innovating, creating the innovation that enables to translate this data into an action. Last one is the media. Also, it is key actor in focusing or changing the rechanneling, let's say, the demand side and public perception of the interventions, but also the maybe problems existing state of the indicators, so they can be an important stakeholder in terms of the communication of those indicators. So yeah, that's all. So thank you for having me.
Many thanks to Dr. Küçükali, for this inspiring presentation. I'll now share the questions from our participants, but before of them, I want to ask you something. You shared Belfast example with us. So what about Turkey? Is there any or are the indicators that you mentioned being measured in Turkey or not? If not, how can they be measured? Thank you.
Yes, thank you for the question. I think it is very important to think about the implementation also in Turkey. I am aware of several initiatives in Turkey, including the municipalities, the Association for Municipalities, but also some leading municipalities are driving the action towards those kind of efforts. But as far as I can see, that those efforts are bit siloed and the very sometimes focusing on some indicators only instead of having a holistic evaluation of multiple dimensions of the healthy and sustainable cities. So we with a small group of researchers, we started analyzing the healthy and sustainable city indicators for Istanbul and also in Ankara. We are planning to continue that with 5 big, the largest cities like Bursa, Antalya, Izmir, those cities. So we are aiming to establish a hub of health and sustainability indicators monitoring hub for Turkey as well, using this geospatial analysis, but also policy indicators I mentioned. So if any participant are interested, feel free to reach out to me, and yeah, we would love to continue collaboration.
Thank you, Dr. Küçükali. There's a question from a participant. I cannot see his or her name. The indicators seem very comprehensive. First question of him or hers: is it practical, easy, or applicable to measure all of them for different cities from all over the world?
Yes, it is not. It is not definitely, and may not be even possible. But this global collaboration that we are part of already identified a couple of key indicators that maybe I can also highlight. So some key spatial and policy indicators is definitely can be applicable wide range because of the recent advancements in the satellite imagery. So it is, and also the availability of like the open data sources like open street maps, etc. So it allows you to, for example, the street connectivity, let's say. So if the data is available in those open source environments, like, I mean, even in, yeah, Google, think about Google Maps. So if you want to analyze the street connectivity of a city, the data is there. The street networks, the data on street networks is there. So those kind of some basic or generalizable indicators are there, possible, but some indicators requires more detailed data. For example, the availability of the transportation, as I shared. For example, the frequency of the transportation. So I know that, for example, for the Istanbul municipality, there is open data for that we already used in our analysis, but not every city, for example, in Turkey, don't have those data, or have those data but don't share publicly. So it depends. It depends which indicators you are focusing on. But my answer is that a minimal set of indicators using open data is feasible for a wide range of applications. But yeah, it depends on the availability of data and resources. Yeah, you need to have trained experts in either in policy analysis or in geospatial analysis. Hope that answers.
Sorry, thank you. And the second question of the same participant is, do you have other indicator suggestions to add those? Are there any?
Yeah, I mean, yeah, we are at the moment working on that. I mean, many indicators are mentioned in the literature, so even some of them are not used yet at all. But so the list is huge. So I cannot claim that the indicators that I would mention not used in anywhere. So it would be too over the top. But I can at least say that, for example, the minimal common indicators do not include air pollution for geospatial analysis. But the team that I'm working in Utrecht University at the moment, we are able to provide air pollution, for example, for maps for entire Europe, and the aim is high, and we want to be able to produce geospatial data using satellite imagery and reference monitoring. So we were, at least as an estimation level, we hope to produce this data in larger areas. So yeah, air pollution as an indicator is already there, but so far it was not very applicable to wide range of cities, but now it becomes more feasible to use those kind of models to estimate all around the world, at least at the moment we have for entire Europe. So those kind of things are possible, but I wouldn't, I couldn't share any entirely new indicators so far.
Thank you, Dr. Hüseyin Küçükali. And thank you all of the participants. Before I end the session, I want to announce there is another event of Hadi 1 hour later. I want to announce that. Please join us, and thank you for your participations, and have a nice day. Thank you.
Thank you for the moderation and all the entire organization team for your efforts. Goodbye.